Thank you all for joining us today. My name is Ken Rooney. I'm going to be the facilitator of our webinar today, the topic being on healthcare risk as well as enterprise risk management. Just a couple of things just for housekeeping. Please submit any questions that you may have or comments via the chat feature, and I'll consolidate those questions during this webinar. And we are offering 1 CPE credit for this live session. So in order to be eligible for that, you need to participate for the whole webcast and answer. We actually have 4 polling questions today. So answer at least 2 to 3 of those polling questions during the intervals of this webinar. At the end of this, you'll be receiving your CPE certificates within 2 weeks in your email. And then there's also going to be a survey that's forwarded to you after this webcast. All right. So thank you all for being here. Today's presenters are Todd Gower. I'm not going to read you their bios. Todd Gower and Augustine Doe. Todd will be presenting on the whole risk compliance, and he runs our risk management solutions for RGP, and Augustine runs our enterprise risk management practice within RGP. I'm going to let them introduce themselves when they're presenting. So I'm going to hand it over to Todd, who's going to talk us through the first part of this, and then Augustine will introduce himself and then talk through his section. All right, Todd.
Great, nice to see you, buddy. So thank you. As you can see on the bio of who I am, I obviously not wearing a suit and tie today for this, making it casual. It's supposed to be informational for you as well. So both Augie and I have been working in this field for quite some time, so we look forward to having any questions related to this. And as Kenan mentioned, it is recorded, so you can go back and look at what we stated. All right, thank you, Kenan. So, do you want me to talk about this one, or
go ahead? Yeah, go ahead.
Okay, cool. So I think from the key takeaways from this is looking at risk, both from enterprise side and also where you might have transformational needs, and thinking through what is that journey. And it can be overwhelming. When you think about the over-encompassing needs of risk management from the first, second, third lines of defense. We can talk about that too later on if you like, about the differentiations between the 3. But our main focus today is around risk transformation and those elements that you might be considering in your overall program or organization. Next slide. So the acronym game. So all of us are in healthcare, especially supply chain has to listen to what it is that compliance needs or operational risk folks need. But this is just a small list of acronyms that we currently come across with our clients, and also talking through our organizations that need support on compliance and risk. And when we think about the RAC, I was a RAC leader for Region A, 13 states in the Northeast. What is HRSA? Those are the areas you think about. Why is health resources and service administration all about? And we think about DEA, of course, it's very popular. There's shows about it, but the reality of it compared to what we have to do in the other areas of compliance is all balanced. I think it's just not as sexy. And then EMR, EHR, there's always that mix between what's being used as a health record and medical record. And this, of course, this presentation is not going to go into differentiations of this, but at least being comfortable with these acronyms to understand when they get used across the organization. Next slide. So our first polling question. Good, Dan.
You guys, our first polling question is, you can see it if you can answer it on the screen. What does CMS stand for? So, excellent. Thank you all. Yes. Centers for Medicare and Medicaid. Thank you very much.
Well, and the guys at CMS sometimes really can't make salads. They have to go buy them. So that's okay. So we used to harass the guys at CMS. But anyway, that's perfect. Thank you, Ken. Great. So when we think about what's a need for risk transformation, and transformation can be overused, but risk is sometimes it can be scary to think of, okay, if we put the risk register together of an organization, the normative risks or inherent risks that are there, it could be a Bible, as thick as a Bible, or wherever you prefer religion. But regardless, though, it's like, what are the key areas of focus and what can be strategic and tactical? And that's where Augie and I will go through that process with you and talking through that. But what is strategic for organization? What do I need to get done on tactical, and making sure that if we're working in an organization, we don't have any sanctions or enforcements against us and fines. Some of my current clients are going through it right now, where they thought they had a good compliance organization or good risk organization. Because of COVID, this is very timely. Areas of concern related to risk are getting missed. And so what the Fed has been doing, since they've been paying out all this money, especially to SBA loans, to hospitals and health systems to help them out, there's a need for them to come back, and they're coming back hard right now. So in 2022, the end of this year will be a very would be very very hard for folks. So anyway, thank you.
Todd, real quick, I'm curious about this, and especially with this audience and some of the clients that you've been meeting and some of the clients I've been meeting. Can you share with this post-COVID or pandemic towards what has been the focus in regards to some of the strategic focus that you're hearing that clients are focused on, or i.e. another way of saying it is where they're focusing their funding on?
Yeah, a lot of them are thinking through what they're trying to grow as a business, because there has been some stagnation in their business and they want to expand to new areas. And because of what COVID has done, is actually diverted a lot of attention and resources to what normally would be something that would be strategic. And they're finding themselves in a bit of a pickle, like, okay, what do we have to do as a result? We have to create a plan of action to make sure that if we're going to this new area of business, that we've got all of our T's and I's crossed and dotted respectively. And so with that, they know that if they go into this new area of business, they've got to get their programs in place. And we found a lot of them, as well-intended, they may do a great job of their accreditations or maintaining the relationship with the DOI, Department of Insurance, or with their health market leaders with the state. They fail in the areas of the overall risk program. And so they might get themselves into a CIA, corporate integrity agreement, or potential indictment because people are not watching what folks are doing and practicing medicine or giving care in the care of telemedicine and being diverted in counseling sessions. So the advent of COVID or the pandemic had created a new environment for pushing out telemedicine and remote learning and remote teaching and remote, especially on the healthcare side, and remote care. So I think that's where this is becoming truly apparent, to think about areas of risk. Now we're looking in a remote place, the remote areas of care, unlike we've ever seen before. And folks aren't coming back to work because they like doing work remotely. A lot of our consultants found this to be a great opportunity for them as they come out of being the industry to help their healthcare leaders out doing things remotely. I have folks that moved to Maine, and so they're helping folks out from Maine to people down in LA. And so it's becoming a big mixed bag of care, of treatment. And actually some healthcare companies are going through the policies and procedures. They're going, can we now, since the emergency orders have now been closed out, if you will, or they've expired, they are now forcing these companies to think about how they do practice medicine from one state to the other and what level of care can be provided. So the state boards are looking at how they give definition around that. So there's a lot of things that are happening as a result from this. So it's a good chance that if you don't do this well in 2022, there's going to be probably a more deeper dive in how people are caring for others across state lines. So
Todd, this is right on. I'm glad you said something. I was thinking you would go towards the direction of telehealth and all this remote diagnostic work and remote monitoring and the risk associated with all that, doing this in a remote fashion, not only just our employees, but care, patient care in a remote, and how that impacts a risk organization, right? So yes, strategically, organizations want to not grow their revenue, but grow and improve patient experience, improve quality, but at the same time doing this from a remote in a remote manner. I just would think, you talk about strategic risk would just be one of the top things. Even cyber risk would even.
That's right. the cool thing about this too is the thing about you go to your CVS or Walgreens and you have the drive up window. Strategically, Walgreens had to make sure, CVS had to make a strategic decision on how they want to dispense meds without people coming in, or make it less taxing for the individuals to come in, make it easy for them to pick up their meds outside, or even the COVID testing. Well, then the follow-up action happens like, well, there's HIPAA concerns about yelling out that person's medication on the loudspeaker in the line where you're getting your tube of stuff and putting in, or at the front window counter yelling out, yes, I've got this condition. Yes, this is my protocol. And the pharmacist having to tell you what the procedure should be as you take it home with you. So the follow-up medicine practice now, though those rules have expired for a lot of pharmacists to cross state lines to give medication therapy management to individuals receiving the care, it becomes very cumbersome and a risk to the organization that they're actually practicing out of scope of practice. So there's a lot of things to consider. And I know, Augie being an attorney or JD here for us can talk a little bit more about risks there. But yeah, it's been really interesting to see our clients look at things a little differently as a result.
Thank you.
Yeah. So when you think about risk transformation services, these are just a bucket of things to consider. So if you're starting to think through in conversations with leaders about what does it mean about risk? Well, risk in general is just that, right? It's an impact to the organization, but it would mean an adverse effect to the organization. So how do you protect yourself against that? There's various things you can do to logically break them apart. So it's not just talking about risk in general. So if an organization is looking at the risk maturity models, which Augie can go into a 2 or 3 hour conversation on that just alone, and compliance effectiveness, thinking through what do I need to be worried about on the various protocols prescribed by CMS or the state regulatory boards, and then the overall program effectiveness, thinking through how effective are your audit programs from internal audit and external and from compliance audit, and reporting and technology. We just had this conversation this morning around you could be tooled up completely, but you still miss the boat because you're looking at your monitors. When I was an artillery officer, the one thing they taught us this is that, yes, the little tools are great, the GPS systems are great, but you still have to go back to the map and measure where the round's going to land to just double check, because sometimes the technology be wrong. So you can't rely on your tools completely. Otherwise, you could have a mistake, a false positive, if you will. Right. And then you think about how you look at your compliance organization or internal audit organization, how do you balance that out with resources? Because sometimes you can't hire from within because there aren't any resources there. So you have to have this blend, if you will, for special projects so you can at least get your coverage and audits done. There's a way to do that. Right. And then third-party risk management and pharmacy compliance are all unique based on provider or payer setting. Thinking through either you're the one that's contracted as a physician with the payer, or with you as a health plan, looking at your contracts with providers or with other vendors, along with providers looking at their vendors too, but making sure you've got your vendor management risk clearly identified on who you're dealing with. Either someone that could be on a disbarred list, which could be a huge challenge for you, that you're actually practicing with someone who's been disbarred, or someone who has now been contacted by the DEA or DOD or DOJ, that's still operating and they shouldn't be, and you're still working with them. So it's just a matter of looking at your third parties that support you. And lastly, on pharmacy, it all depends on what the setting is in, either other health plan side from a formulary to the hospital side or retail pharmacy side, looking at your risks there in pharmacy compliance. Go to the next page. So risk transformation maturity. So this is what we talked about earlier, one of the circles. And how do you measure the role of risk in governance? So assessing your overall governance program, it could be the result of a newly hired executive that's come on board. So we've had this conversation today. Someone's been there for 5 years. They still haven't done their overall Big Bang assessment of compliance. And what they need to do is provide an assessment, strategically look at their area of what they need to find as weak points, or and also enhance their strong points, so they can actually be more of a strategic partner to their operation. And typically the time frame around these assessments can be 6 to 12 weeks, depending on the size of the organization and the complexity of the maturity needed to be reviewed. Next page.
Todd, talk to me a little bit about this risk transformation
Yeah.
maturity, in regards to how this, I would think right now would be the time that this reassessment would have to happen. Because I'm wondering what's happened in the last 2 years.
Yeah, it has. And it's, as I mentioned earlier, we had one client that seemed to be doing really well with their program and enhancing on it from services they're providing to the clients in a care delivery setting. But what they didn't understand is that they had folks practicing care remotely, and the dispensement of the treatment programs they had was not properly managed from the inventory standpoint. So there could be possible interactions with officials that would render them to close the business, or potentially whoever's diverting the program, the treatment program, could be put in jail as a result, because it's highly regulated from a Schedule 2 to Schedule 3 drug. So you're thinking through those maturity levels of why it's important to really assess that and understand that. It gets back to understanding your business. And if you don't have a strategic plan, like a lot of companies will just say, we just operate as a business, and we have a checkoff list of saying we've got compliance, we talked about that today, where it used to be more of an exercise of just, yep, we've got it, we've done our due diligence. But regulators or folks who are more seasoned in the space, who are getting money we're giving money to you, to that organization. Could be a large group plan or what have you. They're going to look at your organization and say, okay, what kind of compliance program do you actually have to make sure we're getting all the services, and let's audit that. In one case, we had a federal program for a health plan. They found out they had $9,000 of an invoice that was charged fully to the federal employees program that should have been charged 50% down to $9,000. And so they got a fine for that, right? So it's like, it's those little things that come up by going, how are you really tracking for that? And so you have to really understand your area of risk and saying, well, that's that level, how mature do we need to be to make sure we can track that and capture that? That's where the fun starts. It's really assessing what are the nuances that need to be covered in risk management. And depending, regardless of the size of the organization, if you're getting any federal state funds, they will find a way to make sure they get their money back if you're doing it wrong. So it's always good to have a little health check, like you go to the doctor. As much as it may pain you to sit there for 15 minutes, it could be a 1 week exercise, a 2 week exercise, just to do a quick overview to see how your health is of your organization on compliance. Or you just do a quick 1 day session to see, okay, how do we want to go about this? And it does take time to plan for it. It really does, because it's just not a checklist item, because every healthcare organization has their unique delivery model, be it a payer delivering membership and health benefits, to a provider who's delivering care to a hospital delivering care with their provider groups. So does that help, Kenan?
Yep, that helped. Thank you. Everyone, I know there's some people that arrived late to the call. Please put your questions in chat. I can facilitate them through Todd also, and Augie when he speaks. Thank you. Todd, I know this just came across my mind.
No.
Let's talk about risk transformation, the maturity model, and going concerns of providers these days.
Yeah.
Have you been working with clients? I mean, there's a lot of opportunities for integration, right? Acquisition, right? And then at the same time, we've been working sadly with some smaller facilities that I think have a going concern just because of what's happened in the last couple of years. Not any different than any other business, sadly, but outside of healthcare, right?
Right.
And so what's some things that this audience or that they should be considering right now in regards to their risk maturity, other than stuff you just addressed, but anything that should be around going concern or?
Yeah, I think it's looking at your charter, right? Thinking through what is it that you're supposed to be doing, and it gets back to those base levels. And you look at your overall program. Do you actually have an audit program? You could probably miss an assessment 2 or 3 years or so, and then come in and do it. But do you actually have a program that's actually looking and asking questions aside from training, that's one thing, you can track your training, but do you have a program that's going in and assessing your key areas of business, 2 or 3 areas of key areas of high risk that could potentially close you down or stop you from getting any new members or taking in new patients, just treating what you have. And it's really getting down to that. Like, what are you doing to make sure that you're protecting yourself, to understand if your business is treating individuals with certain conditions and that's all it is an outpatient clinic, or to a major hospital system that has several different lines of services, to a payer who has different membership in different programs, be it small group or individual or commercial, regardless of Medicare or Medicaid, having the right checks and balances in to review how those interactions are happening with their members. It could be the marketing program, enrollment, disenrollment. It could be how they're taking appeals and grievances, along with physicians who are not actually operating within the scope of practice because of COVID. You got pediatric care doctors working in the ER for COVID for adult medicine. You're seeing a lot of this happening. They're just trying to find people to take care of people right now. So it's a good chance to have a gut check, to sit back and reassess where do we have the biggest risk, and make sure we're getting those gaps filled, or at least a mitigating plan to get there.
Thank you.
Welcome. This gets back into program effectiveness. So once you've done your maturity and thinking through how am I doing, what exactly do you actually have as a compliance organization, a program organization that's looking at how they're practicing compliance or risk? This could be a new chief compliance officer, CCO, or chief audit executive, CAE, who's new to the organization, or first time leader, or part of the annual process, or just transferred in. And all those things can happen, and making sure that, okay, like we were talking about earlier, there are these 7 elements that are very key to an organization. We can go into another topic or conversation later on for another webinar if you like, what that all means. But understanding that there are certain prescribed protocols that CMS has given everybody, so it's very easy to follow. Now there is some gray area of like how it gets done, but again, at the same point, do you have these things in place? Do you have an audit program in place? Do you have a chief compliance officer? Do you provide assessments? Do you have a monitoring and auditing program? Do you follow up? And so even that gets back down to the data of what gets transferred to CMS when they ask for the data. How timely is it? How accurate is it? Especially on calling back to members and patients on certain protocols. So CMS, knowing that it can't send out auditors all the time, they're going to look at data and making sure your organization is prepared and effective. There are ways to look at that with a program effectiveness review, aside from maturity review, but more importantly is how the efficacy of your program is going to be key. Go to the next page. So we talk about third-party risk. So we think about the general assessment to automated reporting and monitoring that. Just as I mentioned about auditing for maturity, now you look at your effectiveness of your program. And, you say you've got a mature program, how effective is it? Then you dig deep into another area, like, what, our vendors, we haven't checked their business associate agreement, has it been updated? Or we may have vendors that don't have a business associate agreement and they need to get one because they're now touching healthcare and patient data, or vendor or personal identifiable information. So you have a number of things to think through, especially around what Kenny mentioned earlier, around cyber risk. IT has been a really big pusher of this on third-party risk because of the need for third parties to support IT that will touch the IT system, that may touch member or patient data, and they may be onshore, offshore, or near shore, be it Canada or in the South America or the south part of North America. So you have all those things that exist, aside from, are they practicing what they're doing, or looking at the rates they're charging, based on most favored nation clauses. If you're a 501c3, make sure the organization is providing that to you and testing that. So when you think about third-party risk, there's a lot of things to consider and look at when you look at your controls that you need to monitor for your vendors, be it a contracted entity from a health plan to a provider, or a provider to a health plan, or a hospital to a group of providers, or specialty in support of ambulatory care or ambulances, just that delivery piece, where a lot of fraud has happened in the past with fake invoices, or they really haven't provided the care they're supposed to. They have a lot of grievances against them, and they have not rectified or made good on the findings of that organization. So third-party risk management has a broader view than just by name itself. There is a need to make sure that's done, at least on an annual basis, to assess how your vendors are performing. And it's just good hygiene. It just really is. It's not doing an inventory is a survey. It's actually looking at the contract, looking at the invoices, assessing who they really are, and making sure too, the vendor master in your AP is set up properly so that, oh my gosh, is it my cousin who's actually working with us? I've got a conflict here. There's all those things to consider in third-party risk management. I don't know if you have any questions on that one, Ken. No. Okay. So when we think about a compliance framework, and we're talking about risk in general, but when we get down into compliance as that second line of defense, how does that framework look? And what we mentioned earlier about effectiveness, efficacy, or the maturity of organization, these are the elements and things to consider to look at that. From the compliance function itself, what the technology is to monitor, from infosec, or decision support reporting out on areas of breaches, to process of P&Ps, incident response. One thing that really trips up a lot of organization is that incident response issue. Making sure it's properly categorized, properly followed up on, and that it's not missed, so you don't have a whistleblower. That's where we're seeing a lot of this lately, where companies are just tired. They're not following up on the incidences. Employees are getting tired. They're seeing problems. They're raising it up to executives, but executives are tired too. And they're missing the responsiveness that needs to happen from their organizations to look at incidents. And it now has cost everybody a lot more time, just like that ounce of prevention is versus a pound of cure. It's that little thing that you want to do periodically of checking and assessing your organization and doing a pulse check on your people. So that's where this framework that we use, and I've used in the past, is helpful in explaining this to compliance officers. It's not just having a compliance program with a checklist and audit. All these things that are going to be considered in the overall program, especially tone to top. We have when I was working and living in Latin America, we had a saying, the fish stinks from the head. And so it is that conversation point where you're looking at the tone of the top. What's the tone of compliance, of risk? Are the leadership looking at risk proactively, and then supporting the risk leaders to make sure they're actually communicating, hey, we've got some key issues or concerns, to make sure our code of conduct is not being jeopardized, or that our strategies are being jeopardized because we're not monitoring risk. So that's where this all kind of plays into graphically, to have the conversation with compliance leaders. I'll pause there if there's any questions. Great. Next.
Polling question number 2, we'll set this off. Who helps in third-party risk management? IT, compliance, operations, all of the above?
I forgot there's a fifth one's like your parents, right? So,
Yeah.
but.
Yeah, there we go. Yes. All of the above. Thank you.
Good.
Okay. Todd, thank you very much for that. And again, if you guys have any questions for Todd, let us know. We are at the bottom of the hour. We're going to go ahead and start with Augustine. Augustine, if you again could give your background or your introduction of yourself, and we'll move forward with the slide. Thank you, Todd.
Thank you, Todd, and thank you, Kenan.
You're welcome.
This has been very good, and it's a good segue into what we do as far as strategic enterprise risk management. I'm the enterprise risk management lead at RGP. What that entails is helping companies really take a look at their strategies and deducing from those strategies the challenges or opportunities that come associated with those strategies that they formulated, and how to really navigate them or exploit the opportunities to continuously perform better. So next slide, please. Now, this slide, the purpose of sharing this slide with you guys and everyone today is to give you a picture of what's going on, what the current state is, and what I would like you guys to start thinking through as you go back to your organizations, so that you become really more productive members of your team. Now, what you see there is that over the past decade, we've been spending a lot of time on achieving the operating, legal, compliance, financial reporting risk. We've been doing a phenomenal job at managing those, which is really, really important. We call those table stakes risks that you need to really, as a base, must tackle first. Now, what we've also noticed is that while those are really important risks to be managing, organizations need to start thinking about, okay, what are the risks that if we really do a good job at managing will really lead to us achieving our patient safety goals, accreditation goals that we have, our revenue goals that we have, our human capital development goals that we have. So, and looking at those risks, it is clear that strategic risks are the risks that when you really spend a lot of time managing, you're able to achieve those goals that you've set for yourself or the objectives of the organization. So we're thinking of, when we think of you guys taking a look at risk, we want you to start changing your mindset to doing all the operating, the legal compliance and the financial reporting piece, and shifting your focus more towards now the strategic components of risk. Now, I'll pass right there if there's any questions that come to mind on this particular slide.
Nothing on. No.
Nothing. So we're going to move to the next slide.
Oh, just a quick polling question, everybody. Polling question 3. In the past decade, what type of risk caused organizations the most loss in market value? Financial reporting risk, operating risk, strategic risk, or legal and compliance risk. Mixed bag here, Augie, of answers. Strategic risk, right?
That's to be expected.
Yes.
In fact, that's the reason we are having this type of conversation today, because what's going on is we're learning a lot more about operating risk. We're learning a lot more about financial reporting risk. And those are front and center every day of every conversations that is in our environment. However, we need to take a step back and look at what research is telling us. And the research is telling us that if you really want to move your needle or you want to achieve those organizational objectives that you have set for yourself, your patient safety goals, your revenue goals, what you majority of risk you need to focus on is the strategic risk. And the strategic risks are those risks that are going to prevent you from achieving your strategic objectives or goals. So we can, operating risks are good. It's kind of like flossing. It's a good hygiene to have. But if you really want a strong teeth, you still have to do the fundamentals of making sure you're getting the right calcium in your body to let you have the strong enough teeth before you can floss. So let's move to the next slide, please. So now, how do you get to, have strategic risk be your focus, and how does it help you really achieve the goal of organization? Here is what you need to start thinking about. Now, with strategic risk, when you are able to manage them more effectively, you start seeing, the environment where you are getting better traction with whatever you're trying to achieve. You can also improve performance. And how do you do that? Well, one of the ways that strategic risk really has helped, achieve your goals is it increases the probability of achieving your goals. How does it do that? It helps you come to terms with the reality of both your internal and external environment. Now you know what the challenges are in that environment, even as you formulate your strategy. So you're able to formulate better strategies that really, when you go to execute, becomes easier for you to execute because you're really aware of the resource capabilities that you need to get those objectives achieved. The other way it helps the organization get better execution traction is it allows the management to talk a lot more about what are some of the fundamental challenges they are experiencing. And that conversation allows for easier solutions of how to get around those challenges to execute better. And then the third component is really when you start thinking about strategy and really making sure you're executing through your strategic risk, it narrows your focus to those things that are essential or critical for you to really achieve goals. And therefore, it leads to more efficient or optimal financial performance, where you're not trying to boil the ocean. You're more focused on, here is my strategy. What are the things I need to do to achieve those strategic objectives and goals? And fourthly, while you're looking at achieving those goals, it also really narrows your focus on even the compliance part. What are the key compliance items that I need to focus on for each strategy? And so that narrowed focus allows you to not just go on a shopping spree where you're buying all the EGRC systems out there, or you're spending money on all the Medicaid tools out there, but your focus, your spend becomes more tailored to what your strategy demands so you really are focused on those right compliance items that would really get you where you need to go. And so if you need HIPAA and the aspect of HIPAA that you're not doing so well on, it focuses your attention on that. So your resources are really optimally spent. And therefore you end up really meeting regulatory compliance unique to that particular strategy that you're trying to achieve or objective. And same thing here with your information security, really, because it allows you to really continuously to be more focused and look at every strategy. What is the security? What are the security needs of executing that strategy? So it's a really very, I call it, it's a very right fit way for you to run your business, where you don't stretch yourself to do everything that needs to be done in your industry, but you only do it from the standpoint of your specific, unique strategies. What are the core things you need to do to get your strategies achieved? Let's go to the next slide, please.
Actually, before we go on the next one, though, Hayagi, one of the cool things that, when you and I work together on this stuff, what have been some of the pitfalls and challenges you've seen from leaders that, just don't think about their road for navigating risk the way you've outlined it here? So just some problems and challenges you've seen where there's this the right way to do it, but give me some examples, like, what they should have done and they didn't do it. And because you've crossed a number of industries in your career, and just curious about for this team here, your thoughts around that.
Todd, excellent question.
Yeah.
One of the key things that we see all the time is the taking on of too much in very short time. Strategic risk should be approached from the standpoint of looking at your strategic objectives and coming up with the challenges unique to your strategy, not the entire industry's challenges. So when we begin conversations with leaders, what we normally find and routinely find is the focus on cyber, the focus on all the risks specific to their industry. However, when you look at the strategy or objectives that they are trying to achieve, we want them to start thinking about what are the components of cyber that are really intimately involved with your specific strategy, so that you're not trying to boil the ocean and become so overwhelmed with trying to solve every risk as in your industry. So that's been a big, big thing that we've observed over time, that once you're able to do this assessment or narrower focus, you feel more confident and feel more relaxed that I am only focusing on those items that are unique to us, to what we're trying to achieve in Medicare, to unique to what we're trying to do in terms of growing our revenue. And therefore, it becomes a lot more manageable and you're not overwhelmed.
Actually, I'm going to ask the participants if you can. I know that when you respond to the chat, you all won't see the answers in the chat, but I'm actually going to ask you to put an answer to this in the chat. And I'm going to ask the question to you, Augustine, as well as Todd. In regards to enterprise risk, I can't help but to think that as an organization, that you would have to almost relook at what's happened in COVID in the last 2 years and re-diagnose enterprise risk as things like, and I'm going to say, and just flatly, I know some of our healthcare organizations are requiring their employees to be to have the vaccine, and if they're not vaccinated, they're going to lose employees. They're going to have to transition out of the organization. I would think that would be an enterprise risk in general.
Yeah.
I mean, so. But my question is, if you, all of you on the participants, if you could put in the chat some of those right now thoughts that you think would be driving the relook at enterprise risk of your organization, from cyber to things that your organization, that would be great. I'll share them with everybody as you type into the chat. But Todd and Augie, I'm going to stop talking and see if you guys have. Hey,
I think let me touch on this real quick. Where and Augie definitely knows this as an enterprise piece, but one of the things that's so funny when we're doing ERM and having a risk leader like Augie come in, and before you had this little section about black swan events. And black swan events are those things like a pandemic or an earthquake, things like that are just not really planned. You kind of plan for them, but you can't because it'd be too expensive to always plan for them. Well, the pandemic happened and people thought, even with large life science companies, this will pass in 3 months and we'll go back to normal. No, it's been like 1.5 to 2 years now. So folks are really have to rethink their overall ERM program and have folks like us come in to think that through. It's like going, let's think to those areas that you thought were black swan events. They're coming to life, meaning that if you have a pandemic, you might lose some people from the death themselves, or the fact that, you know what, it's not so much death. People just don't want to work for you because you're forcing or mandating a vaccine. Because it's federal mandated or it's state or local mandated, those things happen. So now you've got a labor force that's clearly impacted as a result. You got people who are going to be out of work. You got monies that were supposed to go to that business now no longer have that business. So you have it's macroeconomics on a scale that we've never seen before. And you also have issues with supply chain that's impacting life sciences and medical device companies of getting products and services from different parts of the world and global as a piece and part something that's unique for their medical device. Now that can't come over because they're locked in Hong Kong somewhere or Shanghai. I've got clients where I'm on a board of a couple of companies where we're seeing that we can't get product or information when things will be delivered like we used to have. All those things on top of this too, on the financial side, just thinking this through, it's not so much of, okay, you pass the regulatory requirement. Well, you got to have the regulatory issues that are impacting financing. When you think about the financing piece, it's more around, oh my gosh, there used to be a predictive model of your revenue coming in and your AR was X. Well, because of the pandemic, the AR is now slowed down significantly. Days of getting cash collections is completely slowed down. So those revenue models are also being impacted for potentially accruing revenue that was on a cyclical basis that could be counted on and that had consistency to them and passed the muster of controls for consistency. So all those things, those nits and gnats that are coming into play, all because of COVID, now has exacerbated every line of risk area that could be impacted. So it's not just, oh, everyone gets sick and they can't go to work. Well, no, it's the whole macro piece of a business. That's where ERM is going to be really crucial.
And to add to Todd's point,
Yeah.
you know, our former president, Dwight Eisenhower, said it best: plans are useless, but planning is everything. What that means is that while, you know, things don't happen the way we plan for them, and, you know, you shouldn't spend your time trying to figure out all the black swans and, you know, be ready for that. But if you spend the time to do the planning, what it does for you is it allows you to become nimble, resilient, so that when things do happen, you have the capability to pivot. And companies that have had the opportunity to really take a look at their business models and understand their supply chain, understand their human capital needs, and have gone through a little bit of planning, they are outperforming companies that didn't do that. I was at a recent Emerald City event in Seattle, where we spent time to understand what's going on with the supply chain, to understand what's going on with CISOs and what some of the pandemic challenges. And one thing that came out of that is that planning had helped them become really nimble, where they can quickly pivot to things that could help them really address any changes that are happening. Now, it's a lot more ad hoc, but it still allowed them to get solutions for each challenge. The human capital, like the Great Resignation, there are a variety of ways that CISOs and supply chain managers put together solutions to address those in really very record time. And those companies that did the planning and went through that are very intimate with the ability to pivot and have been very, very successful at pivoting and doing very well.
And thank you, Joni, for adding in workforce capacity, burnout, right? It's some of the risks that's going on too. So thanks for putting that in the chat. Yeah.
Huge. I mean, the thing about recruiting too, so for recruiters, and, you know, having one of my family members being an exec recruiter for a large hospital system, docs or director chairs, heads of nursing for units, they're burnt out. And now, how do you find a skilled individual like that out of the air? You can't. That's a highly trained individual that's now out, and that's now going to impact care, because now you've got, again, as I witnessed this too, visiting ERs and assessing this, you got people who are clearly licensed to practice medicine, but put in situations where they haven't dealt with that on a recurring basis, now putting people at risk. And it's becoming a problem. You know, health plans a little different because you have you know, membership basis, but then you have people who are fatigued by dealing with all the appeals and grievances from the members. And it's just, it's a catch-22. You know, you want to help everybody, but you can't. And then if you want to have remote learning, or I'm sorry, remote working, but then bring them back to the office, they don't want to work now. So it's just, it's unprecedented because of what the delays have been getting this under control. So
thank you.
And just to be clear too, you know, RGP does not have a political opinion on this. We're not saying that mandates are bad or anything else like that. We're just saying that this is a reality we're hearing and seeing from our clients. So
yeah, thank you for clarifying that, Todd.
Yes, you're welcome. You're welcome.
So our next polling question, our last polling question, is: in the past decade, how much time did organizations spend on managing strategic risk? So we talked about strategic risk being one of the opportunities. How much time did an organization spend on managing strategic risk? And
how come I can't vote?
So actually the answer is 6%. I'm trying to back up to that slide, but it is not much time.
No.
Right? Sadly, that organizations aren't spending on this issue about this.
Well, I mean, just you and I were just talking about this today with other clients, and they go, "Oh, let's work about it until the end of the next year." Like, wait, hold on a second.
Yeah,
you can't just delay this.
Yeah. Yeah. Just to clarify, Todd and I were on a meeting earlier, and one of our clients was talking about they're looking at And let's wait till next year to talk about the enterprise risk and re-scoping. It's like, oh, okay, I guess we want to wait till next year. It was just an interesting conversation.
Sorry, Linda, you couldn't vote. Apologize. We'll count you as accurate.
Yeah, yeah, thank you.
Well, and then one of the reasons for that is what it's this next slide is going to walk us through, where we need to start thinking about things in a really very different context, that we do have compliance, legal, financial reporting risk. Those are critical things that we need to be managing on a day-to-day basis. At the same time, we need to also be looking at the strategic objectives that we're trying to achieve in the strategic goals. And the good way to do that is to follow these steps that we've outlined here. These would really bring you to terms with your execution realities. What are the things that, based on your individual strategy or objectives, what are the things that I need to be doing as an organization to be able to achieve those strategic goals or objectives that we have set for ourselves? You know, and it starts with these steps. Now, depending on where you are in terms of your the maturity of your program, you can start from the fifth step or you can start from the fourth step. So it depends on the individual organization where they are. But in the end, you need a lot of the things that talk to us about earlier on. You need to be doing an assessment. You need to be benchmarking what you're doing to leading practices. You need to have some sort of a program or software that gives you a real good sense of how well you're doing, how well your efforts are actually getting the traction that's needed for you to achieve those goals. And those things needs to be happening continuously.
Yeah, I mean, the interesting thing about this too, I mean, Augie's a competitive runner, so he likes doing steps. That's why he likes doing this slide. You know? But yeah, I mean, you got to take your time to this process. I mean, what Augie and I see with our clients, it's amazing. They just want to get to 7 right away. Like, well, you're not going to do that. You can't jump from 1 to 7. You know, you just can't. So, I mean, you could, but you got to be really in good shape to do that.
to do that. So these are some of the things that we think that when you start doing and start focusing on, you can start addressing your strategic risk a lot more clearly, which would help you really improve your performance, and you will be able to reach your patient safety goals. That's, you know, your cybersecurity goals. You can grow your revenue the way you want to grow you can get the members that you want to be part of your network. So all of a sudden, you're looking at the big pieces of your organization, and you are moving them in the direction that helps you achieve your goals.
Right. I mean, one last thing to mention too is that there's a lot of information out there on the internet, or interweb, as that movie goes. But you see a lot of that, and that can help you through this process. But really, if you want to right size it and understand it better, it is recommended to find some professionals like us who are certified in the space to look at risk, either from IT or from the clinical side or from whatever, to think it through, because you could misdiagnose yourself or misthink of where you are in your maturity or where you are in your area, and then you can get yourself in a bit of a bind if you do get audited thinking that you have it. So I think it's really important as you're going through your organization, thinking strategically. It does help to think it through with some professionals that understand risk, and to waylay any fears you might think is a high risk area, and quite frankly, may not be as high as other areas you thought were low. So it's just thinking through that process, and it's always helpful to have professionals thinking it through with you.
We are 5 minutes before the top of the hour, and I haven't seen any really questions coming through the chat. If there's anybody has any questions, please ask them now. Or the other part of it is there's Todd and Augie's email there, right? Or if you have any questions, you can send it to our general mailbox, partner@rgphealthcare.com. Okay. So any questions? Well, thank you all very much for your time. Thank you, Todd and Augustine, for your time and efforts on this. And everybody have a great rest of your week.
Take care.
Recording.
Thank you, guys.
Bye.
Bye.